Hey, good morning, everybody. This is Brittany Jennings with the Seniors Blue Book, and today we are doing a Seniors Blue Book Live with Carol Pandis from the Hearing Clinic of Venice. Good morning.
Good morning.
How are you today?
Good. How are you?
I'm good. I couldn't hear you.
What?
See my giant ear behind me and see what I did there?
I love the ear. That's perfect.
So, Carol, I'm so excited that we're here today together to talk about some really relevant topics within the kind of COVID-19 arena, just kind of touching on some of those challenges and some solutions that you have through Hearing Clinic of Venice. But first, if you don't mind, tell us a little bit about yourself and your background.
All right. Well, I am Carol Pandis. I am at the Hearing Clinic of Venice. We are a division of Hearing America. Hearing America has about 33 locations throughout Florida, Georgia, into South Carolina. And we are, besides being centrally located in Venice, a great resource for people to be able to come and have free hearing testing and also to receive education. I think that's one of the big things that we at Hearing Clinic of Venice, as well as Hearing America, has really focused on, is getting education out there to people.
Absolutely. I know we've done a couple of videos and a couple of, before the quarantine time, we were kind of doing some things out and about at some places. And I think people just need to know more about hearing and how it can affect so many different parts of your body, your mental health. So we've kind of touched on some of those in the past, but what are some of the benefits of having hearing aids and having your hearing checked?
So the big important thing is we don't really think about the fact when you go to your doctor every year, they take your blood pressure. Then they ask you, have you been and had your eyes examined? And then usually they'll do some blood work. So most people know some of their scores. They know their eye, they know their vision, they know their blood pressure. But one of the things that a lot of people don't really think about is hearing. And hearing is just, it affects so much in our body. And so it's just really important to be able to think about an annual hearing test, being able to really be able to know what your individual hearing is, especially someone like you, young and healthy, but importance of having at least that good baseline.
We talked about in the past how I was actually shocked because I'm in my, we'll just say mid-30s. And I had no idea that somebody my age, when we think of hearing loss and we think of hearing aids, you almost think of kind of an aging type of population or average age. But at what age do you recommend somebody does come in and get that baseline?
Definitely, hearing loss definitely has the stigma, is what you're saying, for that senior population. But we really feel that anybody over the age of, I always say at least 45, but I recommend even younger, because let's use, for example, one of the things that causes hearing loss can be ototoxic medications. So things like cancer treatments, life-saving drugs can affect, can really harm our hearing. So even somebody young, if they've had a good baseline screening, then if all of a sudden they have some type of medical emergency or something happen to them, and all of a sudden they're noticing, I'm not quite hearing the way I used to, it's great because then we have something to really be able to compare it to. But so again, on an overall basis, we always say 45, but when I'm talking to people, I tell people, tell your kids, even tell your grandkids. So really think, anybody 20 years and up should at least kind of know what their hearing is so that we can keep track of it going forward for them.
After conversations with you, I actually started listening to my music at a lower level.
Bravo.
So right now, I definitely want to kind of get into some of the today type of challenges that people are facing. Wearing a face mask, we're all doing it. We're all required to. So I know for somebody who is hard of hearing, a lot of times they rely on reading lips and being able to kind of, understand and communicate that way. So tell us a little bit about, some of those face mask issues with those that are wearing hearing aids.
It has been such a hardship for this population. The face mask itself, you figure anytime if somebody has any type of hearing loss and covering up the orientation of that lip, then they can't do any lip reading. it's really affected them horribly. So even somebody like yourself or, you know, anybody with good hearing, wearing a face mask automatically just decreases the amount of sound coming through. So even people with good hearing right now during all of this COVID, doing so much, we're doing things to protect ourselves, but unfortunately it's really kind of hurting everybody. But that population with a hearing loss, it's affected them even more. So
Definitely.
you know, the lip reading has a big factor, and even just the ability to, like I said, to understand the words.
And now more than ever, you know, with there's so many different factors going on with the isolation, with some of these things that are occurring for people that are not getting out. They're hearing, I know, for example, even a member of my own family is somebody who has kind of always self-isolated, but this has been really hard on her, to where going to Dairy Queen for an ice cream cone on her birthday was exciting. But, you know, for her, she's super hard of hearing. And so this has made it her more, she's not interacting or communicating as much. And so the additional face masks in this as well, it's just really taken a toll on people.
It really has. And you brought up a key word that we talk to our patients a lot about, and that's isolation, because they feel, especially someone with any type of hearing loss, they, like you could say, a big adventure out now is going, you know, to the grocery store, out for ice cream or something like that. So making sure for those of us that aren't having trouble with hearing to really kind of keep an eye or an ear on your friends and family that have any type of hearing loss, that can really just kind of help keep in touch with them. It lets them know that you're there for them. We've done a lot of that with our patient base that we have, just reaching out to them, literally just making a phone call. Hey, you know, we're calling from the Hearing Clinic of Venice. We just wanted to say hello. How are you doing today? And, you know, they say, oh, you know, we don't, you know, I don't need anything. And we said, that is not why we're calling. We're calling just to be an ear for you. Literally, I
love that.
But, you know, we just literally want to be someone that they know that if they're having a tough day, if they just want to make a phone call, we're able to help them. But one of the things, as we're talking to people, speaking of phones, we're trying to talk to them about some of the free phones that are out there. There's some programs by the state and by the federal government where people can get a free amplified or a captioned phone. So we have a program now where we have someone from a state program coming in once every month, where she sits down and talks to people and is able to set them up with a free phone with Bluetooth, so they don't even have a landline. You know, most of us don't have landlines anymore, but they're able then just to get that amplification from their cell phone into this big handheld phone, which is easier for them to handle, and it's amplified in addition to that. So we've, again, really just been trying to share as much information as we can to help all of those people with hearing loss and their families to be able to still be able to keep in communication.
It's amazing. And I know we've definitely, we have some partners who also work with like Captel, and it's amazing that there's so many free, I use the word free because we all love that, free resources that are out there to be able to assist and make such a difference in somebody's quality of life. And again, right now we all feel a bit like, you know, we're socially distanced. So getting that phone call, or whether it's email or whatever it might be, is super important right now to our overall just kind of, you know, energy and mental health.
Absolutely. Yeah, it's interesting you mentioned Captel, because I just had a new patient that I helped get register with them. The nice thing about Captel is they can actually go and install it in the people's homes. And for a while, of course, in the beginning of COVID, they weren't doing that. So it's great to have a good partnership with them. And now they're able to do that again, as long as the home proves safe. And, you know, these people come in masked up, safe, and making sure that they're just as safe coming into people's homes. So yeah, so again, it's just so important to do as much as we can to keep that communication open.
Definitely. And kind of speaking of those precautions you mentioned, so what about with you guys? So when somebody does come in, or they want to set up an appointment for a hearing test or to get hearing aids, what are some of those extra precautions you guys are taking?
So one of the first things we do is a good phone screening. So we ask them, you know, have you been outside of our area in the last couple of weeks? So we kind of go through a series of questions on the phone. But the big thing in our office we've been trying to do is kind of just stagger the appointments, give longer time in between the appointments. I kind of joke with our office manager, Lindsay, she kind of follows them around with disinfectant. The minute they come in the door, she follows them and cleans off the door. If they happen to sit into our waiting room, which we're trying not even to have, we have people come right in and be able to come into the office. One less place for them to have to touch and for us to have to follow up on the disinfectant with them. But so between staggered times, longer times in between patients, we have a program where we have curbside pickup and drop off. Someone that's an existing hearing aid wearer maybe just wants their hearing aids turned up a little, or they maybe aren't working, they need a little cleaning. They can call us up right from the parking lot. We'll go out, we'll get their hearing aids, bring them in, clean them up, and take them right back out to them. That way they can stay safe and sound in their car, and know that they don't have to worry about, you know, any additional exposures. Because again, to this population, most of the population that we deal with, this is the higher risk type of population. One of the things I mentioned even this morning, we are on a conference call this morning, a Zoom call this morning with you. And one of the things I mentioned there is this great program called teleconferencing, where literally it's remote programming. Some of the new hearing aids that are out there, literally we can dial into their hearing aids and make adjustments, turn them up, turn them down.
Wow.
And really big advantages of this program is it has a Find My Hearing Aid built into it. And you can imagine the removal of the masks and just mask on and off all day for some of these people getting caught up in a hearing aid. That Find My Hearing Aid program has been amazing, where they can literally just go to a little app on their phone and it can pinpoint where that hearing aid is. Luckily, most of the calls we've had, you know, it happens to be right onto the edge of the mask, maybe even hanging in their car, or, you know, on the floor of their car, or something like that. So, you know, but we've still unfortunately had quite a big group of people that have lost hearing aids during all of this too. Most of the time, again, if the hearing aids are usually within about 3 years, they do have insurance loss and damage coverage on there. So it's not, you know, like they have to go buy new hearing aids, but we're definitely spending a lot of time helping people with that. One of my favorite pieces is I want to show you the mask that I wear. So this is a mask with a nice clear face. One of the things that with this population, right, we have a lot of people that can't hear, and we already talked about knowing that we really want to be able to read lips. But one of my favorite things that one of our patients said to both Lindsay and I, she said, one of the things she misses most is people's smiles. So it just kind of brought, you know, that extra good feeling to us to know that we're helping our patients by at least making sure that they can read our lips while we're here, but also maybe providing a smile once in a while too.
I love that. I love it so much because it's so true. Like there's a simple quote that has followed me throughout my entire life, that smiles are contagious. And it's true. And so that is something that when you go out in public, it's a little bit, you know, it's a little daunting, but you know, you can see when somebody's smiling, they're little, I call them my crow eyes. But that's such a great innovative idea for you guys to pivot to those, to be able to communicate better with what you're doing. And I do want to bring up one thing I thought of too with what you were saying. These hearing aids are so smart these days. Like, it blows my mind that there's something called Find My Hearing Aids, you know, that there's a way to do that, that they're Bluetooth, you can tune into them. I mean, there's so many just cool, hearing aids are cool these days, right?
Absolutely. And, you know, people think, oh, I don't want to get into wearing hearing aids. One of the things that I do lots of times on the weekend, I'll actually take a pair of hearing aids home if I'm going to be listening to different books on tape, and actually wear those all weekend instead of having to deal with the cord and the plugging into, you know, my ear with headphones and all those things. It's actually kind of a great little treat for a lot of people. Being able, again, to listen to, like I mentioned, books on tape or their favorite music or videos. But again, also back to that, talking to their family and friends. A lot of them connect right up to their smartphones. The minute they answer their phone, the call goes right to their hearing aids. And, you know, the caller doesn't know, they don't ask, are you on speakerphone? Take me off of speakerphone. I hear that, I'm sure we all hear that a lot. So, you know, they don't get asked that because the call is just so straight right into their ears, and the caller can hear them wonderfully too. So yeah, the phones and the hearing aids, it's really become a great extra for me. Like you say, it's a lot of fun for me. So I think it's wonderful.
Well, it's amazing. And I want to remind people too that when people come in to get a hearing test from you, that is a free test, correct?
It is, yes. So at our office, we always provide a free hearing test. Again, besides the importance of what we already talked about as having the annual screening, there's a lot of insurances that don't cover anything having to do with hearing aids. A lot of insurances don't cover hearing tests. So instead of trying to bill a person's insurance like that for a hearing test, we're able to provide that completely free for everybody across the board. And that way we can really say, you know, that we feel like we're providing the best service, because we don't want them just to come one time and then go away. This is every year, literally for the rest of someone's life, whether they decide never to get hearing aids, or if they do wear hearing aids, that's another integral part of what we do, is because we do an annual test. Let's say maybe their hearing's decreased a little bit. They might not realize it. They might not know that they need their hearing aid turned up or, you know, tweaked a little bit. But we determine that when we do the actual testing, and by doing it every year, we can keep their hearing aids up to date and current so that they can last a good long time for them.
I love it. I love it. And I've been to your office. It's a great spot. What is the best way for people to reach out to you if they have questions or they want to schedule a test or find some hearing aids through you?
So we are located at 1872 South Tamiami Trail, and that's in Venice. We're in between Shamrock and Seminole, right on 41, about a half a mile south of Lowe's. And our phone number at the office is 941-244-2922. They can always reach out through our website, which is www.hearagainamerica.com. The great thing with that is, especially if someone is listening right here in Venice or our surrounding areas that we service, it does show all of our offices, all of the 33 offices that we have throughout the area, that maybe they can find someplace, whether they're in Naples or Orlando, wherever they might be listening, and find an office that's within our group. We all fall under pretty much the same thing, and always all offering that free hearing test.
Awesome. Well, thank you so much for your time today. I'm always so excited to see you. Do you have a guest? Lindsay!
Anybody that calls the office, Lindsay is our office manager. She is our right-hand man, our left-hand man, everything here in the office. So
your left ear, your right ear.
Your right ear, right? So that's the smiling face you get to talk to when you call.
Awesome. Well, and I will say this, whenever I call, I can feel her smile and her energy through the phone.
She is amazing. Absolutely.
Well, you both are, and you're such a pleasure to talk to. And so I highly encourage anybody right now who, either yourself or a loved one, or if you have, this is a professional listening and you have a client, reach out to Carol and Lindsay, get your ears checked. I guess I need to come by, and we talked about having lunch, maybe have my hearing test done too. Perfect. Listening to loud music for 34 years, you know?
It will happen. Again, unfortunately, noise exposure is the biggest cause for hearing loss. So, yep, so that's, again, another reason why it's important to have that tested. We appreciate you having us on your show today. Thanks, Brittany.
Absolutely. Thank you. And everybody who's tuned in, thank you so much for watching, and we'll see you soon.